Thank you, Chairman, for your kind introduction. And when you called about a month or so ago to say that the town committee would like to hold a healthcare forum as a bit of a recruiting tool for the Democratic Town Committee, your strategy was brilliant. Obviously, I'm really impressed with the turnout here this evening, and it is, as you point out, a great opportunity for people out of the town and out of the district to see what a jewel Woodstock Academy is. Not just its location, but quality of education that takes place here. Their arts curriculum in particular, the students here consistently either win or place in the first, second, or third place in terms of the congressional art competition. And I'm glad everybody has had a chance to come out and take a look at this wonderful campus. I'm not going to talk for a long time because 8 o'clock is going to come along pretty quickly, and I just want to first of all say that it doesn't surprise me that we have a big turnout here. We've had about 12 town hall meetings over the course of the last 6 to 7 months where we again have had packed rooms, people who are understandably and justifiably anxious and concerned about the direction of this country, the direction of the economy, and the issue of healthcare, which as someone who chaired the Public Health Committee and the Human Services Committee when I was in the state legislature and spent a lot of time working on this issue, I understand to my core how personal and how important this is to every single person. And the debate that's taking place, this national debate that's taking place right now, has engaged people for that very reason. And believe me, I am completely prepared to answer every question to the best of my ability, but also understand that this is at the end of the day, choices have to be made and action is going to be taken, and you're not going to win a shutout here in terms of the outcome, in terms of people's support. But what I would tell you is this: when I ran for Congress for the first time in 2002, with the experience I had working in Hartford on issues of healthcare quality and access, one of the things that really burned me was watching public leaders in Washington, D.C. who had a great, comprehensive, affordable package of health benefits paid for by the American taxpayer, who at the same time were so unwilling to address the crying needs that Jim described in his opening comments that affect middle-class Americans as well as poorer Americans. And it is, and because of that, I made a pledge to the voters of this district that if elected to Congress, I would not take that taxpayer-subsidized congressional health plan, and I have kept that promise. Let's be very clear, the average value that the American taxpayer puts for a member of Congress in terms of a family health plan that they have made available to them the day they're sworn into office is worth about $8,000 a year in terms of the taxpayer's share of premium costs. And it seems to me that it's not too much to ask that the people who make public policy in Washington, D.C. should at least try to come up with a system of access and quality that is at least comparable to that which the taxpayers of this country generously provides them. And that, and when I approach this issue, that is the measuring stick which I apply to what I consider a plan that is worth supporting. And when you step back and you look at this document, and again, as somebody who was on the Health and Pension Subcommittee, which Jim referred to, we are one of the 3 committees of the House that have marked up this bill over the last month or so. We had over a 20-hour markup at the Education and Labor Committee where we went through this bill provision by provision in painstaking detail. And at the end of the day, to me, that the standard that I came to office with is the same standard that I'm applying as a member of Congress in 2009, which is are the American people going to have an opportunity to have access to the same quality of care that the people that they send to Washington, D.C. I believe at this point that H.R. 3200 does pass that test. It doesn't pass it tomorrow after if the bill were to be signed into law by President Obama, but it would in 2013 when a purchasing exchange goes up online offering a choice of plans that people would be able to buy into that is comprehensive and affordable. And that is exactly what members of Congress have today. When you get sworn into office, you get a pin, you get a voting card, and then you get basically a menu of health plans. In Connecticut, members of Congress can pick Connecticut, Aetna, HealthNet, and a couple others. I think the Anthem Blue Cross are the plans plans that you have available to you, with very stable premiums and very comprehensive benefits. And the purchasing exchange, which HR 3200 will go online in 2013 and offer to the American people, will be structured and designed in exactly the same fashion. Now, there are other components of this bill in terms of changes to the Medicare system, and there's also large investment in the healthcare infrastructure of this country, investments in nursing, primary care, community health centers, which are desperately needed. We talk to anybody in the medical professions about the fact that we need to strengthen that end of the system. My wife, Audrey, is a pediatric nurse practitioner, and I hear about it every day from her, about how the nurses are burning out and we don't have enough coming online to replace them. And this bill will give what I think is a desperately needed investment in those areas.